Hello, future nursing students. Welcome back to UWorld's live NCLEX review. My name is Nicole here with another question drill set. Welcome and good afternoon to all of you guys. We are going to be doing a question drill set over post-operative questions. So everything after you have a procedure, whether we're looking out for certain interventions or doing certain interventions, maybe medications and side effects that we might be looking out for, just everything in the post-op realm of things. If you don't know how a question drill works, I will explain it to you. I will pull up a question right up above me, give you about 30 seconds to review the question, look over the answer choices, and then drop down what you think in the chat, what you think the correct answer is. Then we go over why the right answers are right and the incorrect answers are wrong, so we can get in a better cadence to answer these NCLEX style questions. Our questions here at UWorld mirror like what the NCLEX actually gives you. So when you practice more, you get better at answering these questions. So let's get in the rhythm of answering these NCLEX style questions. We have Nurse Rebecca in the chat moderating for me today. So if I go a little bit too fast or you need reiteration on maybe a certain topic or a question or an answer, ask down in the chat and she will be sure to answer any of your questions. So let's get started and have some fun. Question number 1, the nurse is caring for a client with a chest tube attached to a closed chest drainage system. Which of the following findings would be a priority to follow up? Option 1, intermittent bubbling observed in the water seal chamber. Option 2, crepitus around the insertion site. Option 3, serous drainage, I mean, it also could be serious drainage observed in the collection chamber. And option 4, clamp drainage tubing. Let me know what you guys think down in the chat, whether it, and as well as rationales that you guys might be thinking versus certain answers, not certain answers. Let me know what you guys are thinking. Hello. Someone says, hello, Nicole. Hi, Jess. How are you guys this wonderful afternoon? Someone also says, can't see the question. Just wait a little bit. It might start appearing here soon. Abracadabra. Hopefully it is now. I'm seeing some good rationales already. Good job, you guys. Be sure to like, follow, subscribe on your favorite social media platform. We are so close to reaching 100,000 followers on the Clock app. Cough, cough. So if you could like, comment, and subscribe on TikTok, that would be great. We would like to reach our goal by the end of the year. So make sure to tell all your nursing cohorts, your nursing student friends, everyone to follow us on uworldnursing.com on whichever platform that they might be watching on. Good job, guys. It's pretty unanimous. I do see a couple of 2s, but for the most part, everyone is clicking on for option number 4, that clamp drainage tubing. So let's go back to the question. Which of the following findings would be a priority to follow up? This is a negatively worded question, meaning that we're looking for something that is wrong that we need to follow up for or follow up on because it's going to cause harm to the client potentially. So option 4, that clamp drainage tubing would or could potentially cause harm to the client. So a chest tube. This is a closed chest drainage system that removes air, blood, any fluid that is in the pleural space of the lung and helps re-expand the lung. So this is a device that needs to have an open system or a closed system, but the tube needs to be open for it to do its job and work correctly. So if it is clamped, then we are negating the whole system of the chest tube. So it needs to be unclamped to allow that drainage, the air, the fluid to go from the pleural space out to the negative pressure system. If there is a clamp tube or clamp tubing, you can cause tension pneumothorax, which is a severe complication and could be potentially life-threatening. So make sure to follow the line. Sometimes it's not an actual clamp. It could be a pigtail that turns the connection of the airflow off to the client or off to the drainage system. So the main thing that I've learned in nursing school is to follow the line all the way up to the client, because sometimes that pigtail or the stopcock can be right up against the client's chest or abdomen. So you can see right there that it is off to the actual drainage system. Options 1, 2, and 3 are all correct things that we would be seeing or not needed to be followed up on. Option 1, that intermittent bubbling observed in the water seal chamber. This is okay and is expected as it is releasing all that drainage and fluid. If it was continuous bubbling, then we would be concerned that it might be an air leak, and that would be something that we would want to follow up on. Again, that means that the system is not doing its job. But intermittent bubbling is okay. It kind of happens with deep breathing and any fluctuations with the breath. Option 2, crepitus around the insertion site. This is something that could potentially cause some side effects later on, but around the insertion site is okay because we have a foreign substance or foreign object in that skin and in the chest area. We would start worrying if it starts spreading to the upper abdomen, to the neck, to the chest. So something that we do want to monitor, but around the insertion site is okay for now. And then option 3, serous drainage observed in the collection chamber. This is okay. Could be an expected finding as well if that is what we're pulling out from the pleural space. If we have a large amount of serous drainage, that could be something that we would want to monitor because that could be a potential complication. But serous drainage is something to be expected in the collection chamber, so it is okay. But a clamped drainage tubing is something that we never actually want to see. But you guys did very good. Question number 2, the nurse is observing a staff member caring for a client with an arterial line in the right upper extremity. The nurse should intervene if the staff member is observed doing what? Option 1, inserting a peripheral venous access device in the left upper extremity. Option 2, zeroing the transducer at the level of phlebistatic access. Option 3, monitoring the insertion site for warmth and erythema. Or option 4, administering analgesics through the arterial line. Let me know what you guys think on this question. Congratulations, Care to Care For on TikTok just passed their NCLEX. Congratulations, that is so awesome. Anybody else that just recently passed their NCLEX or maybe just scheduled their NCLEX to be taken very soon, or anyone that's waiting to take or waiting on the ATT, their authorization to test. I know that's also a very big number of you guys, but patience is a virtue. But drop it down in the chat. I would love to give you guys a shout out of congratulations or good luck or patience is a virtue. Let me know in the chat if you are one of these fun, lucky people. Jess is going to take theirs next week. Good luck to you, Jess. Afia also passed their NCLEX. Thanks to you, world. Congratulations. That is so awesome. Thank you guys so much for using UWorld, and we are here to help you pass that NCLEX on the very first time. Fidel's waiting for the ATT. Natonki just scheduled for their NCLEX. Lots of people waiting for the ATT. Love Symbol just passed their NCLEX, found out today. Congratulations, that's so awesome. Lena's just graduating next month, so you are just at the beginning of this whole process, but you got it. Aaliyah takes theirs in 2 weeks. Jel just passed their NCLEX. There is so many people about to take their NCLEX in the next couple of weeks. So you got this. Take it slow and steady. You know the information. You're watching us here at UWorld. You're getting the practice in. You got this, you got this, you got this. And for those who just recently passed, congratulations to you guys. Welcome to the RN world. Thank you guys for coming back and tuning in. Even though you passed your NCLEX, it's always good to still come back and watch us, stay in the know, keep your skills and your assessment and your critical thinking up with these NCLEX style questions with our live. So thank you guys for tuning in. So correct answer for this one would be option 4, administering analgesics through the arterial line. So let's go back to the question. We have an arterial line in the right upper extremity. So an arterial line provides that continuous blood pressure monitoring, but it also gives us access if we need to do arterial blood sampling. But the main thing is we get a lot of information from the arterial line. We never want to give anything to or through the arterial line. So that is why option 4 is incorrect. We never administer analgesics or pretty much any medication through the arterial line. We get things out of the arterial line. So don't ever administer or push anything through arterial line. Excuse me, options 1, 2, and 3 are all correct interventions or correct things that you would do when managing an arterial line. So inserting a peripheral venous access site in the left upper extremity. So that would be the opposite extremity that the arterial line is. So this is a good intervention to do because we want to always do all of our interventions on the opposite side. So this arterial line can have its full flow and not have any infection or I guess forgot the word I was going to say, but any interactions with this arterial line. Option 2, zeroing the transducer at the level of the phlebistatic axis. This is very important to do, and main thing to remember after you reposition the client, that transducer is what's interpreting the waveform of the blood pressure and giving us that reading. So that phlebistatic axis is right in the axillary in the fourth intercostal space. And so if it's a little too high or too low, it can give us false readings. So it needs to be zeroed out every single time that you reposition the client or you pull them up in the bed so we can get accurate information. And then option 3, monitoring the insertion site for warmth and erythema. This is always best practice. If we have an invasive line, we need to be monitoring for infection. So warmth and erythema, that would be our indicators and something we would want to do. But the main thing in our question is should intervene. So we're looking, negatively worded question, looking for a wrong action. So never administer analgesics or any type of medication through an arterial line. But you guys did great. Love to see that. Next question, the nurse is caring for a client with a closed wound drainage system. Which of the following actions should the nurse take? Select all that apply. Option 1, assess the insertion site daily. Option 2, strip the connection tubing once per shift. Option 3, document the color and consistency of the drainage. Option 4, secure the closed wound drainage system to the client's gown. Or option 5, compress the bulb prior to attaching it to the connecting tubing. Let me know what you guys think in the chat. More congratulations to you guys. Love, love, love that. Good job, everyone. Also, shout out, we just came back from our NSNA conference that was in Columbus, Ohio. It was so good, so good to meet a lot of you guys there on the ground in Columbus. It just warms my heart seeing you guys and y'all not being afraid to come talk to us. We're fun people. Nurse Samantha, Nurse Rebecca, and me, we love to chat with you guys. So don't be afraid to come up to us if you see us at a conference or in real life, if that happens, and say hi. And yeah, we have CNSNA this weekend. I will be in San Diego. I leave tomorrow to see some of you guys in California for the California Nursing Student Association conference. And then Nurse Rebecca will be at SNAP in Pennsylvania next weekend or next week. So be sure to say hi to us then as well. And there's going to be more conferences for you guys to come meet us at. Or you could go to uworldnursing.com and book a Clexpert and we can do a live review session just like this with your school, with your cohort. You need a good group of them. So ask your faculty or get a group of your friends and we could do a live private lecture with us. So that would be cool as well. We love meeting you guys and talking to you guys individually. It again, makes my heart happy. Okay, correct answer for this one is options 3, 4, and 5. So closed wound drainage system, and we're looking for actions that the nurse should take. So this is a positively worded question, meaning we're looking for correct interventions. So with this one, I'm since a lot of these are actual interventions, I would want to act them out. So I would want to document the color and consistency of the drainage. This is me documenting what is happening. If you don't chart it, it didn't happen. So we need to document it. Option 4, secure the closed wound drainage to the client's gown. This would be correct because we don't want this, what I would call like a JP drain or any type of drain that is attached to them hanging and dangling, because it can cause tension on the actual client's skin, but then it also could very easily dislodge. So securing it usually with a safety pin to the client's gown is usually the best practice, so then it's not causing any tension on the line. You just have to be careful to make sure you unsecure it before changing the gown or anything. And then option 5, compressing the bulb prior to attaching it to the connection tubing. This is again a correct intervention to do, because that suction that is going to be in that bulb is what's drawing out that fluid or air from the insertion site or from the insert or place that it is put in. So compressing it prior to attaching it is a correct way to attach the connecting tubing. Option 1, assess the insertion site daily. A lot of you guys got tripped up on this one because yes, we want to assess it daily, but actually way more than daily. You want to be assessing it frequently, usually a couple times per shift, to make sure it's not dislodged, make sure that there's no signs of infection. You want to put your eyes on it very frequently because this is a foreign object that is in a client's body. So assess it more than daily. You always have to be very particular whenever an answer choice has any type of timing with it. You need to be as precise as possible. So daily, not so much, because you want it way more than daily. Option 2, strip the connection tubing once per shift. This would actually be an incorrect action. It's actually not best practice anymore. That's what a lot of people call milking the tubing. This can increases the chance for dislodgement as well. So we never want to strip the connection tubing because it can cause dislodgement. So don't do that as well. But you guys did very good. Some people are asking about option 1. Why not option 1? Because we want it more than just daily. You want it a couple times per shift just to monitor for signs of infection, but also dislodgement. So be very particular with those timings in the answer choices. Question number 4. The nurse is teaching a client who has a new prescription for patient-controlled analgesia, a PCA pump. Which of the following information should the nurse include? Option 1, pain will be eliminated while receiving PCA. Option 2, continuous IV fluids will be connected to the PCA tubing. Option 3, medication is delivered each time the delivery button is pressed. Or option 4, family members can push the delivery button while you are sleeping. Let me know what you guys think in the chat. Good job, guys. I'm seeing lots of 3s, a couple of 2s. This is a positively worded question, so we're looking for a correct answer or correct intervention or correct teaching point for a PCA pump. Also, we're halfway through. We only have 7 questions today, so we'll get through this a lot quicker, but we're halfway through, so I can ask my favorite question every week. Where are you guys tuning in from? I love to see how far you world reaches in the world. See what I did there? Let me know in the chat where you're tuning in from. Let me give you a shout out for how far you're coming in from. We see Indiana, Tennessee, Zimbabwe, Cincinnati, Jamaica, Maryland, Nigeria, Canada, Philly, California. Hope to see you this weekend. Oklahoma, Uganda, North Carolina, Ghana, Baltimore, Virginia, Rhode Island, Ecuador, Georgia, United Kingdom, Maryland, Nevada, Los Angeles and Las Vegas, Cleveland, Puerto Rico. It goes so fast, it's like blurring in my eyes. Florida, Finland, Massachusetts, Puerto Rico, Ghana, New York, all caps, New York, California, Oman, West Palm Beach. That sounds really beautiful right now. Uganda, New Orleans. Y'all are tuning in from all over the world. I love to see it. Thank you guys so much for taking a little bit of time out of your day to review your NCLEX, or not review your NCLEX, but review NCLEX style questions and get a better practice at answering these. But I'll move on to the answer, which is option 2. Continuous IV fluids will be connected to the PCA tubing. So again, going back to the question, is it positively worded or negatively worded? In this case, it's positively worded. So we're looking for correct answers or information about a patient-controlled analgesia, so a PCA pump. So with PCA pumps, we do connect continuous IV fluids connected like Y-sided into the client to help push that medication that is delivered, the actual pain medication, into the client. Since the client's getting a small amount of pain medication with each button press, we need to have continuous fluid going with it, usually at a very slow rate, maybe like 10 to 20 mils an hour, to make sure the line is being flushed and all that medication is being pushed into the client. If it wasn't being Y-sided in with continuous fluid, that medication would probably just sit in the line for a significant amount of time before it actually is getting pushed into the client. So we usually Y-side continuous fluid into the medication. All the other options, 1, 3, and 4, are incorrect for a certain reason. So option 1, pain will be eliminated while receiving PCA pump. Well, yes, this is the goal for a PCA pump, is to reduce the pain. It's not guaranteed that it will be completely eliminated. Sometimes it will be significantly reduced, but eliminated is not a guarantee that we can promise the patient. And if there's one thing I also have learned in nursing school, is don't promise your patients anything. So don't promise that or tell them that it can be totally eliminated, because that might set you up for a very long shift. And then we also use other mechanisms to help reduce the pain. So whether it's heat or cold, PO pain medications, it's not going to be totally eliminated just with that PCA pump. Option 3, medication is delivered each time the delivery button is pressed. Again, with the timing in these answer choices, you have to be very careful. This is incorrect because each time is setting the client up for respiratory depression. So there's usually, and it's a part of the doctor's orders, a lockout period and a max amount of medication that a client can receive in an hour or so's time. So if they go exceed that, it's a safety parameter to make sure that they don't overdose themselves or give themselves too much medication in a short amount of time. So after that lockout period, it's not going to deliver the medication no matter how many times they keep pushing it. That's very important in this good safety mechanism that is needed with these clients. And then option 4, family members can push the delivery button while you are sleeping. This is incorrect. Again, it's a patient-controlled analgesia. It's named that for a reason, a PCA. Family members are highly discouraged from pushing the button because, one, that they're not receiving the medication, so they don't truly understand or feel the pain that the client is experiencing. So the patient should have all the control to administer all the pain medication to help their pain be relieved. So family members should not be touching the button. Okay, good job, guys. Question number 5, the nurse is teaching a client who had surgery 12 hours ago how to use an incentive spirometer. Which of the following information should the nurse include? Option 1, raise the head of the bed to 45 degrees before using the device. Option 2, use the incentive spirometer once per day for 1 week. Option 3, clench the teeth on the mouthpiece of the incentive spirometer. Or option 4, inhale slowly to raise the piston to the goal marker. Let me know what you guys think in the chat. Someone was asking what's the max again on the PCA pump. This is for the other question. That is per patient, per the doctor's order. So each client could be different, and it also changes between what type of medication you're receiving, whether it's Dilaudid or morphine. There's a lot of different things that go into it. So that's an individual type of question. Let me know what you guys think for this question, maybe include some rationales with it. But while you're thinking it over and dropping your answers down in the chat, again, a shameless plug to go to uworldnursing.com. We have a lot of the resources, whether it's our full event calendar of what we're going to be covering in the next couple of days or a couple of weeks, actually. We have usually about 2 weeks out of the topics that we're going to be covered at uworldnursing.com. But we also have that book a Clexpert, so you can book us to have a private lecture with your cohort or with your school. We had Mount Sinai do this with us a couple of weeks ago. They're the first school to do it, and I hope to have so many of you guys also do it. I met a couple of faculty at NSNA last week that would be super interested, so I hope they're the faculty of your school. But if not, get your nursing student group of friends and book a Clexpert. But then we also have a lot of other resources. So that 1 week free trial, you can do question of the day or question of the week. Lots of things to help you pass the NCLEX on the very first time and stay in the know of all things NCLEX related. Someone was asking, could I teach elimination process of elimination? That is a good way to go about these questions. So let's use process of elimination with this question. So the correct answer would be option 4. But if we're using process of elimination, let's go back to the question. Which of the following information should the nurse include? Meaning this is a positively worded question, meaning we're looking for correct interventions or correct teaching points. So what do you know about incentive spirometer? We do know that it's usually given to clients after surgery or clients who are on prolonged periods of bed rest, as it helps re-expand their lungs or have lung expansion. We want them to take big, deep breaths so they can prevent things like pneumonia and atelectasis. So clients that are on bed rest or have had surgery recently usually aren't taking bigger breaths, and that can cause this atelectasis or pneumonia. So in doing the incentive spirometer encourages that. And one way that we do that is inhaling slowly to raise the piston on the goal marker. A lot of people get confused on whether you inhale or exhale with an incentive spirometer. The way that I remember it is incentive spirometer. So you inhale. So in and in. That's one way to remember. A lot of people think you exhale and blow out. Those are different type of mechanisms. I can't think of the word of the specific things, but those are different, like not nebulizer treatments, but other treatments for other lung disease processes. But inhaling with an incentive spirometer is the correct teaching point. Option 3, clench the teeth on the mouthpiece of the incentive spirometer. This would be incorrect because you don't want to clench. You could bite down and hinder your actual inhaling flow, and that could make you have a false number or make the piston not go up as high. So you just wrap your mouth and create a seal with your lips, but you don't clench down on it. Option 2, use the incentive spirometer once per day for 1 week. Again, when you're looking at this individually, those timing in the answers, you have to be very certain that that is correct all the time. So with this one, it is not correct because, again, you want to do this more often than once a day for 1 week. That's not going to be as effective. So we usually encourage them to do 5 to 10 times every hour while they're awake. So that's significantly way more than once a day for 1 week. And then option 1, raise the head of the bed to 45 degrees before using the device. This is almost, but not quite. Again, it's a number 1, so you have to be absolutely certain that is true. That is not right in this case because we want them at a 90-degree angle to help with that gravity and that lung re-expansion. If you think about it yourself, it's harder for you to take a deep breath when you're reclined or laying down versus when you're standing up or sitting up straight. So having them at a 90-degree angle will help them have that bigger and better lung expansion. But you guys did pretty good on that one. Good job. Question number 6. The nurse is caring for a client who had percutaneous coronary intervention via the right femoral artery 15 minutes ago. So they're fresh out the cath lab. Which of the following actions should the nurse take? Select all that apply. Option 1, instruct the client to report changes in sensation to the right lower extremity. Option 2, inform the client that back pain is expected following the procedure. Option 3, monitor the client's right pedal pulse every 15 minutes. Option 4, initiate continuous cardiac monitoring for the client. Or option 5, place the client in the high Fowler's position. Let me know what you guys think in the chat. Someone was asking, what days are the lives usually? We go live multiple times a week, multiple times a day, sometimes even. We go live Tuesday at noon with a lecture. And these are all during Central Time because we're here in Dallas, Texas, so everything revolves around us. Just kidding. Central Time is just what we know. So noon Tuesday with a lecture. Wednesday, we go live at 11 a.m. Central Time and 7 p.m. Central Time. Thursdays, we go live at 11 a.m. and 3 p.m. Central Time. Friday, we go live at 7 p.m. and Sunday, we go live at 7 p.m. Central Time. So multiple times for you to tune in. If not, make sure to hit that bell on the corner of the screen so you can get notified every time we do go live. That's another hidden feature and shameless plug that I like to say, so you can always be in the know whenever we do go live, which is always fun. Good answer. Someone was asking, can the real test have more than one answer that's correct? So those are usually the ones like select all that apply, or when a question says priority or most. So not necessarily that any of the answer choices might be wrong, but you're looking for the priority. Which one would save the client's life if you could only do one action? Or which one, I guess is the priority or the most life-changing type of thing to do. So technically, yes, and that is when your clinical judgment and critical thinking skills come into play. Those are also one of the harder questions, like the most. Which one is the most right answer? Correct answer for this one is options 1, 3, and 4. So let's go back and do that process of elimination and figure out what we do know about percutaneous coronary intervention and assessment after they come back. They just came back 15 minutes ago. So that percutaneous coronary intervention, this is something that a client might go through if they're assessing what's going on with the heart. So we usually call it the cath lab, and they go through the femoral artery, or sometimes even in the radial, to see the vessels of the heart and maybe figure out if there's any blockages. Sometimes they place a stent, sometimes they place a balloon to kind of reopen those vessels. But even though it is done in the cath lab, these procedures can be very, very serious, especially if they're going through a femoral artery, which is a major and big artery that can cause a lot of complications if not monitored. So we're looking for the following actions should the nurse take. So this is positively worded. So we're looking for correct interventions. So we should instruct the client to report changes in the sensation to the right lower extremity. Since they went in through the right femoral artery, we want to assess and keep a very close eye on everything on that right side, especially distally to the right or to the insertion site of the client. So in this case, the right femoral artery, which would probably be in the groin area, we want to assess everything distally from that point. So the sensation in the right lower extremity, because we need to make sure that they're having adequate circulation and perfusion and no complications like a hematoma that prevents the circulation from happening. Option 3, monitor the client's right pedal pulse every 15 minutes. Again, that goes with option 1. We're monitoring everything distally from that insertion or puncture site to make sure the circulation is adequate, the perfusion is adequate, and there's no complications, so we can leave at 7. And then option 4, initiate continuous cardiac monitoring for the client. This is something that we just do because this is a heart-related procedure. We want to make sure that we don't cause any other arrhythmias, or it doesn't send them into arrhythmias, because we did go and possibly irritate a lot of the vessels to the heart. So we want to monitor them before, during, and significantly after a procedure like this. Option 2, inform the client that back pain is expected following the procedure. This is an incorrect teaching point. Back pain is not expected, although they are going to be on bed rest for a significant amount of time so we can make sure they have that circulation to the leg and prevent hematoma. Back pain is not expected. That actually could be a complication that maybe blood is pooling in the retroperitoneal area and causing that back pain. So you would have to do further assessment. Make sure it's not just the bed, because we know those hospital beds aren't the most comfortable, but reassess them, maybe kind of reposition them off on the side and put a small pillow behind them. But make sure that that back pain is not from the bed or from something else like the retroperitoneal bleeding. So further assessment is needed, but not an expected finding. Very important. And then option 5, place the client in the high Fowler's position. Again, this is incorrect. We don't want to put them in a high Fowler position. We actually lay them flat and supine to make sure that they have that adequate circulation and blood flow getting to the distal parts of their body. So they are going to be laying flat for a significant amount of time. Good job, guys. Last question of the day. Make sure to let me know in the chat how many questions out of 7 you guys got right today. Question number 7 says, the nurse is caring for a client who has a modified radical mastectomy of the right breast 8 hours ago. These people are fresh from the OR and the cath lab. Which of the following actions should the nurse take? Option 1, allow the client's closed wound drainage system to hang freely. Cough, cough. Option 2, place a safety alert bracelet on the client's left upper extremity. Option 3, obtain blood specimens from the client's left upper extremity. Or option 4, encourage the client to sleep in the right lateral position. Which of the following actions should the nurse take? So positively worded, meaning we're looking for a correct answer or correct intervention. Let me know what you guys think in the chat. Someone was asking, SATA questions, you get partial credit. Yes, you do. So even if you got on the previous question, maybe 2 out of the 3, you do get partial credit. The NCLEX is being nice now and giving you partial credit for these select all that apply. So it's only helping you get to that passing score. So that's very, very good for you guys. Let me know. Good job, guys. I'm seeing 2s, 3s, and 4s. That's kind of all across the board. So I'm ending with a little bit more tricky question. Let's see. They had a modified radical mastectomy of the right breast 8 hours ago. So what do you guys know about that type of procedure and the interventions afterwards for that procedure? I always think if you had something on that side, any type of procedure, we're always going to protect that side from everything else. Someone is asking, who is up for studying together? I am. Tune in every Tuesday, Wednesday, Thursday, Friday. Just kidding. But I would love to be studying with you guys with these live review sessions. But this is also a great place and a great community to link up with someone to study together, because testing yourself with another person kind of helps you remember things as well. Good job, guys. Okay. I got lots of 1s, 3s, and 2s. So let's go over why number 3 is the correct answer. So like I was saying, that modified radical mastectomy of the right breast. So we're going to do everything to protect that right side and give it a rest. So obtaining blood specimen from the client's left upper extremity would be the correct answer or incorrect option, because again, we're allowing this side, the right side that just had the mastectomy, because it's very sensitive and very high risk for infection, because sometimes with those mastectomies, they can go in and take some lymph nodes out and the circulation can sometimes be compromised. So protect and rest that right side or whichever side is being affected. So you want to do everything on the opposite side. So in this case, it would be the left side. So do your blood pressures, put the IV line there. if we're doing blood draws or anything, everything is going to be on the opposite side of the surgical site. So obtaining the blood specimens from the left upper extremity would be the correct answer because it's the opposite side, because we're protecting the other side. Option 1, allow the client's closed wound drainage system to hang freely. This is incorrect. Like I said in one of the questions earlier, you don't want it to hang freely because then it can accidentally dislodge and then cause more problems later on. So secure it to the client's gown or clothing in some type of way. Option 2, place a safety alert bracelet on the client's left upper extremity. So this case, the safety alert is trying to alert you that this is an affected limb. So you actually want to put the safety alert bracelet on the client's actual extremity that is we're trying to keep safe. So putting it on the right extremity would be the correct intervention here. That was a little bit tricky, but it kind of, when you're looking at a client's arm, like, oh, I'm going to go in and put an IV. If you see a big red bandage that says safety limb, that's going to make you be like, oh, take a step back, take a moment, and go away from that arm. So you actually want to put it on the affected arm. That's the only thing that you want to do, is put it on the affected arm so it can alert you to, hey, stop what you're doing and go to the other side. And then option 4, encourage the client to sleep in the right lateral position. Again, you want to protect and rest the side, so you want to sleep on the opposite side. So sleep in the left lateral position so you can have adequate circulation freely on the opposite side, or that right side. So kind of tricky, but you guys did pretty good. Thank you guys so much for tuning in. We go live multiple times a day, multiple times a week for you guys to get these NCLEX study questions. Come back 7 p.m. tomorrow, as well as Sunday at 7 p.m. for more NCLEX nursing. If not, click the notification bell to get notified anytime we go live. And worst comes to worst, visit us at uworldnursing.com to see our full event schedule, 7-day free trial, question of the day, lots of things just for you. But until then, see you guys next week.